Welcome to the Workforce Wire podcast, brought to you by Employ Prince George's, bridging the gap between job seekers and businesses. And now, here's your host, Walter Simmons.
Welcome to the Workforce Wire. This is your host, Walter Simmons, President and CEO of Employ Prince George's. We are in the midst of the coronavirus pandemic. It has taken control of the world. But specifically today, we're going to talk about the impacts of the coronavirus on our Latino community. This is something I saw in the Washington Post, and I immediately called my council member, Councilwoman Denny Taveras, who I know has had her own personal story about the coronavirus. She's been advocating on the front line for our community and those in need. So today, as we talk about the effects of the coronavirus on our Latino community, I am welcoming Councilwoman Denny Taveras from Prince George's County Council District 2 to the Workforce Wire podcast. Thank you for being on the show today, Councilwoman Taveras.
Well, thank you, Walter, for inviting me, and to all your audience, thank you for listening. This is a great time. Well, not really great, but it is. Times for trauma and tragedy are also times for opportunity. And so we have to be able to take this opportunity to make the best of the situation and look for allyships and really work with the community to bridge gaps. And so just a little bit about me. I'm originally from New York. I'm from Harlem. I was an orphan by the time I was 8. I was raised by my grandmother, and you know, we were poor, and we grew up during a time at the height of the AIDS and crack epidemic in the city, and it was very tough. I saw a lot of things. And so, you know, one thing that I was able to take away from all of that experience was that the Black and Latino community stood strong, together, unified, working together. So that's the experience, and that's the energy that I always come and bring to the table when I moved down here in 2003. And so I went to grad school, and I came down here and moved, and I saw that it was a little bit different. I also, for example, I saw what happened with Hurricane Katrina. I essentially packed my bags, went down south, and served in the front lines to be able to assist with what was going on there, because I couldn't believe that in my country that could happen. And so that's the kind of person I am. And so I came back, and my condominium, which I had bought at the height of the housing bubble, my condominium association was facing bankruptcy. And I went in and took it over. And still to this day, I will always say that the hardest race that I've ever run has been for my condominium association. And in that light, my state senator saw what I was doing, and he said, come and work for me. And I've been in politics ever since. And so the opportunity in 2014 opened up itself for me to run. So I ran for the seat, won by 6 votes in the primary. So your vote, every single vote counts. What I've been able to accomplish in the last 6 years that I've been in office is that I've put about $10 billion in the pipeline for construction at all my transit centers and throughout my district. And we've been able to put in the pipeline the construction of 2 libraries, 8 schools, and like I said, the development of our transit centers, and including, I have 3 projects in the $1 billion zone. And the most prominent one, of course, is the Purple Line. And so we've been able to work really hard to lift up the community. The issue right now is that now I represent an area, 20783 in particular, which is the Langley Park, Chilham, Adelphi, Lewisdale area, that has the most coronavirus cases in all the state of Maryland, D.C., and Virginia. And there's a little bit of a delayed reaction in that. We've seen a strong spike in that. But we could talk about that as you keep moving forward in the conversation.
No, that's great information. You know, this is something that, you know, Black and brown communities have been so distraught, and over the years, economically torn down. Our education systems have been underfunded. So to hear that you've brought billions of dollars, everybody, I hope you hear that. We said billions of dollars to your communities, Black and brown community, a Latino community is really key. And I do want to highlight, I don't know if this is right or wrong, maybe you can correct me. The Purple Line project in your district is one of the largest transportation projects, public-private partnerships in the country. Is that correct?
It is.
So that's no small feat. And providing equitable transportation to our communities is key in ensuring that we provide access to jobs, access to education, access to healthy food options. So I commend you for that. And again, Councilwoman Taveras is helping to bring billions, people, billions. So, but you provided a good point. The Washington Post talked about how the coronavirus in the DC metropolitan area has greatly impacted the Latino community, where the Latino community has been equated to 70% of all cases in the region. And in some areas, they only represent 20% of the population. And I heard you mention that. Why do you think the coronavirus has disproportionately affected our Latino community?
It's for various reasons. First off, the Latino community does not have the luxury to social distance and does not have the luxury to telework. Most individuals are frontline workers. In order for them to make a living, they've got to be out on the streets, either cleaning, construction, landscaping, etc. So all the essential job functions are basically being done by the immigrant community and are Black and brown, basically. But the Latino community in particular, because not only is it that they're out in the front lines, when they come back home, they're living in overcrowded housing. We have individuals, the majority of individuals here are paying more than 50% of their income in rent. So what we're talking about is that we have a population that is basically maybe renting a room in a house, 4 or 5 people renting one room or living in the living room or whatnot. And these are people that they cannot social distance. So when they come back, they're not just, if they're infected, they're infecting their whole family. So I have households of 10 people, all with coronavirus inside the home. I had an incident where both parents ended up in the hospital and there were 4 children there, all with coronavirus. And they had to be taken by another family member who most likely than not, the children were infecting that family. So those are the kind of things that I'm facing. And so when we're looking at those kinds of situations, it's impossible for people to social distance. And in essence, we don't have the luxury to telework. And so that's why we're seeing the spike in number. And we're seeing a delay in the contagion, where it was basically Latinos came to spike basically a month after we saw the numbers with a disproportionate amount of African Americans, and then we started to see the Latino population rise after April.
Do you think that I read the news and I talk with a lot of my community members, and I see that we talk about the distrust of the Latino community to engage with local governments, obviously due to the tone of our president in regards to immigrants in our country? Or do you think that plays a role? Is there enough accessible healthcare in our Latino communities? What do you think goes on?
I do think that people are extremely hesitant to disclose where they're from, who they are. A lot of individuals, especially if they're first generation and are probably undocumented, are either underinsured or uninsured. So they're probably waiting for the last minute to go to the hospital. And so in those kinds of instances, what we're seeing is also a delayed response in also being treated, which also adds to the delay in the numbers that we're seeing in the incidence of contagion. In Prince George's County alone, we have, I want to say, 16,116 cases. And I want to say from that, we have about over 5,700 cases. 37% of those are unknown, meaning that we don't know the race. We don't know anything about those individuals. And that's the vast majority. So we had 29% of African Americans that have contained the virus, and 24% of Latinos had contained the virus. And so that means that if a large percentage of the unknown are Latino, which I highly suspect, that means that Latinos are actually, in fact, the number one group in Prince George's County to have the coronavirus.
So now I know you mentioned that you're from New York. Do you think this is the same throughout our major metropolitan areas and throughout the country?
I know that in Fairfax, that's definitely the case. I haven't looked at it I know that in DC, I know that Latinos are the ones to the greatest number they're being infected at a higher rate. And I know for a fact that in New York, Latinos were the number one group to be infected. Like you mentioned, I lost 4 family members in the month of March, and I had 14 family members that were infected. And 14. We all lived, and my family, and almost all my family lives in the zip code of highest contagion in the city of New York.
So first I want to say my condolences for the 4. And, you know, I've heard this and I saw your story. And again, my condolences. And that's heartbreaking.
No, thank you. I mean, the thing is that it is. I mean, because when you're first generation, and the same thing, there's no difference between what I'm living and what somebody like first generation African American coming out of the South moving to the cities. That same transition is exactly equivalent, where you still have to send money back home, where you still have to be able to support other family members, you know, because they may not be able to make the rent, make bail, you know, like I had to pay for funeral costs, you know, so it's hard. It's hard because you know, I'm probably one of the few people in my family that has obtained a college degree. And so it's challenging, you know. And
that's understandable. And I think that's what I try to tell a lot of our people, that I really have advocate for our Latino community. I call them all my Black and brown brothers and sisters, because I see it. I can relate. When I'm originally from the South, Charleston, South Carolina. And when I moved up here, other people moved up here. I had a friend I had a 1-bedroom apartment in DC. And for those that don't know, city apartments are small. So, you know, you understand it from New York. When I say I lived in a 1-bedroom apartment, it wasn't a big apartment. It was you know what I said?
I said, you step into the door and you walk out the window.
Exactly. Like, you know, I can touch both sides of the apartment and just stand in the middle. And I had a friend of mine that moved from the South. He lived with me at a time as he was, you know, pursuing his career. We had a 3rd person move in. So we had 3 people in a 800 square feet apartment, 1 bathroom, 1 kitchen. And we had 3 people living there because 1, that's how we afforded the rent. And 2, that's what you're taught to do within our community. And even when I moved to Maryland, I moved in with my brother and his sister, and all 3 of us lived there before I got my own place. And that's why I understand that multi-generational and that sense of community. And I try to tell people that, you know, we are more alike than we are different. And so this is why this is key.
I agree.
So now let's move on. The reason why I really wanted you on is not only do you represent, you know, people that are listeners and that we can relate to, like Councilwoman, you are us, you are me. I have people that in my family that we have to help pay for bail or send money on their commissary, or people need help with funeral expenses. Exactly. Everybody doesn't have a college degree, but the difference is you're in control. You're a county councilwoman. From your perspective, what supports do you think need to be provided to the Latino community to stop the spread?
We need to provide testing sites that are barrier-free for this population, because this population right now is being extorted. Like when their jobs are forcing them to take tests to make sure that they're coming into the jobs clean without infections, they're forced to go to a clinic that's charging them
$150, $50, $250 per exam for their whole family, when they should be able to get it for free of charge through the county. But they need an appointment that takes a week, and then the result takes another week, and by the time they open up their eyes, they're 2 weeks late when they could just get a fast response from the clinic where they have to pay. So that's part of the problem, creating a barrier-free entry to testing. The second thing that we need to do is start funding a funding source where we're putting somewhere in the ballpark, in my opinion, of several millions of dollars, $10 to $20 million to assist people with their rental payments. Because right now, we have to recognize that we have a population that did not receive assistance we have about over 80,000 people that are undocumented in the county, probably closer to 100, given the time when the report from Migration Policy Institute was released. So we probably have about 100,000 people that are undocumented. A portion of them may still be working, but there's a whole population of them that are not working at all. And they did not receive any stimulus checks. They did not receive any unemployment.
We know they didn't receive unemployment because nobody received unemployment almost.
Exactly. Well, that's true too. That's true too. We also have another 100 people that also are trying to file for unemployment and have yet to obtain it through the county. So that's another, you're right. And I've been sending the people over to the director to address those concerns and was able to get some people paid. And they haven't been really assisted as much as possible through the county. So there are people that are basically, they don't know how they're going to be able to make these payments at the end of 3 or 4 months of being out of work and having a debt of, let's say, $8,000 to $10,000 and only making an hour, $10 to $15 an hour. So, and you have to also recognize that these are people that with this $10,000 rent, they're already paying over 50% of their income in rent. Top of that, they have this additional rental payment, meaning that they're probably going to have to put $50 to $200 or more on the rent to catch up on the past rent. And what about the utilities that are still owed? And they still got to make that payment and the back payment and still be able to pay for food and still send money back to their respective countries in remittances. For people of El Salvadorian descent alone, 21% of the GDP of the country, the gross domestic product of the country of El Salvador, is remittances from the population in the United States. So what I'm saying with that is that, and the World Bank came out with a report that says that remittances worldwide will decrease by 20% as a result of the pandemic. In the region here, in DMV, in the District of Columbia Metro region, we have a critical mass of Central Americans that will impact the remittances of these respective countries in Central America, meaning that as a result of people not getting money there, people will die of hunger. I mean, it's a real global international issue that we have on our hands. And so because of that, we need to be able to provide assistance with rental payments. And on our selfish end, we need to make sure that landlords are able to make their property tax payments. Because right now we have buildings that are in delinquency. In March, they were in delinquency 10 to 15%. Now it's more like 40% or 50% in delinquencies because people haven't been able to pay.
I think as we look at it, that kind of leads me to my next question. What do you think is going to be the long-term economic and health impacts to the Latino community? I think one thing that we're going to see across the Latino community and all low-income communities is mass evictions. Because like you said, people could be 5 months behind, car payments 5 months behind. I'm scared. I'm scared for those people.
If we don't find that money, yes, I agree with you. If we don't find that money, I'm trying to raise $30 million. I'm knocking everywhere I can. I was sitting in a panel discussion with Steve Forbes a multimillionaire. He's the founder of, well, his dad was the founder of Forbes magazine. And, you know, we are in diametrically opposing political viewpoints. I mean, the man is essentially a libertarian. But, I mean, I have to have no shame and go and beg that man for money, literally. I mean, that's the kind of situation that we're in. And
do you think there's going to be long-term health impacts?
I do. Until we find a vaccine, I think we are going to have problems. I also think that we need to establish and ensure that there is a serious quarantine. There are quarantine locations located throughout the county to address the needs of the overcrowding in the apartments to prevent that from spreading. I think that we are already seeing impacts from the openings. I don't know if you saw the news that came out yesterday or a couple of days ago that 21,000 people have been infected from the early opening of the country. And so while I am very, very sensitive to the needs of businesses trying to open and stay operable and trying to recoup some of their losses, I am so concerned, especially in my region, in my area. I'm so concerned that this will lead to a spread and a continuing spread of the virus, because I think we needed to buckle down the way New Zealand, Australia, Taiwan, South Korea did. They waited for the full curve to be flushed out before they reopened. And that's not where we are. If you look at our graph of our curve, we're still in the peak. Yeah. We're still in the peak of contraction. And so I think that the opening as a result has been politically motivated. And it's unfortunate, but that is one area where I just firmly disagree with the county executive on that particular issue.
And I think, you know, I've had a lot of conversations. I straddle the line. I feel like I'm in a great place. I talk to community people. I talk closely with elected officials to really find that common balance. And I've commonly told people that to look at the perspective from that low-wage hourly worker who can't get any government assistance, who isn't getting any help. They want to go back to work because they need to put food on the table. They got to pay their car payment. If they lose their car, they're in an area where they're not accessible, they lose their job, and now the circle of poverty is hitting them. I also understand that every time we open a door, every time we touch something, that is someone who can die. I currently have my great uncle in his 80s who is fighting the coronavirus in New York. I have aunts that are older, great aunts, but you know, I don't want to touch them. I love you because I have to love you from afar.
Everybody's afraid. Everybody's worried. Everybody is, you know, concerned about contagion. So, I mean,